Hey folks, Dr. Melissa Grill-Peterson, functional medicine specialist here with you from Peachtree Health. And if you're watching this right now, then I'm going to make an assumption that you're probably looking for some answers. Maybe you've struggled with some different health challenges, things like for all the right actions, not being able to get some of that stubborn belly fat or weight off your body. Maybe you're now experiencing things like severe fatigue or brain fog, even joint pain, or pretty intense GI issues, maybe things like gas and bloating and indigestion, things that you are being told or made to believe that, hey, that's just supposed to be normal, that's part of aging. I'm here to tell you it's not, okay? So you know you've struggled. You can feel it in your body. You know something's not right. You know there must be another way, and I'm here to tell you that you're right. You're absolutely right. You're not crazy, it's not in your head, and there's more going on, and we've just been sadly missing the mark. So today, I want to take some time and share with you really some components that are directly impacting all of our health and how stress and hormones are creating an increase in belly fat, and we put all that together, was pretty devastating to our health. So let's take a few minutes and let's talk. Before I get into too much of the nuts and bolts, I want to take a minute to help you understand a little bit about who I am and what I do here at Peachtree Health. So again, as you listen, you can just determine, hey, does this really resonate with me? Is this truly what I'm looking for? Because, you know, here at the practice, we can only accept 21 patients a month. That's it, because of the level of the care and what happens in this full curriculum and program. So I have to make sure, and you have to make sure, that you are somebody that wants to be a part of the program, and I have to make sure that you're somebody that we can actually accept into the program, because there are so many people out there. So this way, it's all good. It's not a bad thing if it's not a fit, but if it's a good fit and this is where you're supposed to be, then you're going to know it, and I'm going to know it, and we're going to move forward and create some pretty amazing results in your life. So I've been in the field of wellness for over 18 years and really done a lot with weight loss specifically over those 18 years. But my journey's pretty vast. A lot of education, a lot of titles, a lot of degrees. You know, undergrad in undergrad in bachelor's of science, doctorate of chiropractic. All my postgrad is in functional medicine, functional nutrition, functional endocrinology, functional fitness, and I'm currently wrapping up my master's right now in wellness. And so really my whole adult path has been a study and a commitment, both in clinical practice as well as in life, of just helping people to really be their best. I believe since a young age that it's about how we're feeling inside, and it's more than just a symptom or a piece and a part. And as a functional medicine doctor, that's what I do. I look at you, not your symptoms. I mean, your symptoms are a piece of it, but they're not the whole picture. So I'm not here just to treat a symptom. If you're looking for a place to just get a quick temporary fix, this is not the place. If you're looking for a place to help support really true corrective lifestyle support and get true real lifestyle results, well, then this is the place that you want to be, and I want you to keep listening. So, you know, when we're talking functional medicine, really and truly, it's a little different than traditional allopathic medicine, your normal general practitioner you might go to. Our traditional medical paradigm is set up one of the best systems in the world for acute care. It's tremendous, but right now we are facing an epidemic in this country and around the world where we are dealing with not acute, not short-term problems, but chronic conditions that just keep going and going and going with no end in sight. And the only solution that our medical system right now is able to provide is a pill. And when that pill doesn't work, which is only a small percentage of the time, and that pill just manages, it doesn't correct the underlying imbalances, when that pill doesn't cut it, well, we're still left with the conditions because these pills are not reversing, they're not correcting, they're not helping to heal. So the rates just progress and progress and progress and progress. In 2012, USA Today did a big report and they said, hey, look, Americans, we're living longer than ever. Yay for us. But we are sicker than ever. You know, so it's really coming down to what type of quality of life do you want for yourself, for your family? How do you want to be living? And that's what we're really looking at in functional medicine. It's about not just looking at the symptom, but looking at the underlying causes and asking why. Why are you fatigued? Why can't you sleep at night? Why do you have all this joint pain? You know, why is your body inflamed and responding to foods and having food sensitivities? I want to know. And in functional medicine, I treat you the person, the whole person. And as a result, you know, when you come in, it's very comprehensive what we do. So again, I'm not going to just look at belly fat. I'm not going to just look at fatigue and say, well, maybe it's the thyroid, or maybe it's your GI, or maybe it's this, maybe it's that. Okay? We run a full comprehensive picture of lab tests that really help us to know all the main systems of your body, what's functioning properly and what's not. It's pretty easy, just like that, because health, true health, is really when the body is in a state of balance and ease, and it's working smarter versus harder. Now, when the body is out of balance, imbalance leads to distress, dis-ease, dysfunction. Dis-ease, lack of ease of the system of things working properly, leads to full-blown dis-ease. So it's a progressive process that happens, and it all begins when we become out of balance. Now, that might seem too simple to wrap our heads around, right? But it's the root cause. And let me tell you what is the underlying element of this is the stress that we are faced with today. And here's why. So as we're looking and going, what's the common thread? What's really going on here? You know, there's many ways that the body is being challenged, but the end result for you is all the symptoms. Your symptoms are not the disease. Your symptoms are not the problem. Your symptoms are a sign of dysfunction, of breakdown, of malfunction in the body. So what's some of the components? Well, let me tell you, there is a big one, and it's called stress. Here's the thing about stress, folks. And, you know, we all have gotten too comfortable with that word, really comfortable that it just doesn't seem to have any meaning to us anymore. It's like, I'm stressed out, hard week, oh man, the bills, the kids, the dogs, the cats, the whatever, right? Just life. It's the little daily opportunities that present us moment after moment in our life. And some of us look at those as great gifts and opportunities, while others of us are getting overloaded. It's too much. It's constant, and there's no breather and no breathing room. When the body becomes overloaded, physically, mentally, emotionally, chemically, environmentally, we literally become overloaded. We become toxic, and in a lot of ways, but in a variety of ways, this all triggers what's called the fight or flight, or that stress response. The thing about stress is that, you know, it's a primal life-saving response, just built right into our very DNA, the fabric of us. And the whole purpose is to keep us alive, which is pretty cool, right? That's good. We want to be able to make sure, because back in caveman, cavewoman time, there were real threats. There was animals, there were predators, right? And so it's designed to let us fight or flight. But what has evolved over the course of humanity is we went from a time of occasional conflict with a predator to 24/7 in today's world. So what used to fire off once in a blue moon and was helpful to the body and very purpose-driven has now become really manipulated in the worst of ways. We're overrunning this cycle, and as a result, we are creating so much imbalance, so much breakdown in all the main systems of our body. So if I may, and I don't want to bore you, but I just want to take a minute, because I believe that knowledge is power. So if I can give you enough information to really understand some of the key components that are breaking down your health, that are making it next to impossible, even for changing your calories in and calories out, and getting on the treadmill and changing the food you're eating, you know, even for those changes, you still can't lose the weight. Well, it's because there's a big part that's being missed, and there's dysfunction underneath it all. So as you listen to what I'm about to share with you, really listen and begin to consider in your life the ways in which you may be currently already being overloaded or overstressed. So the stress signal comes. It can be real, like a real predator, or perceived or imagined. So those mental, emotional, that voice in the head that's going and going and going, coulda, woulda, shoulda, guilt, lack, shame, not enoughness, not enough time, not enough hours, not enough money, right? It's this constant, we're being squeezed. All of that is a mental emotional trigger that's triggering this cycle. There's physical stress by means of sitting in front of our computers all day, what I call slumped and in the dump, this forward rounded posture. It compresses our lungs, head in a forward position, decreases lung capacity by over 30%. Now, think about this. If you're not getting oxygen to the noggin, right, then how are you able to process effectively, let alone efficiently? So there's a lot of things that we're doing. Then we add into the mix air pollution, water pollution, pesticides in our food, and petrochemicals in our waters, in our water bottles, and on the fabrics that we're wearing in our clothes. It's out there and it's not going away. Stress is part of our world today, folks. But what you've got to realize is how detrimental it is. Because the more you can identify where and in what ways you are being stressed, you can begin to understand what's perpetuating the dysfunction and the breakdown in your body and in your health, as well as the inability to lose weight, the inability to balance the hormones, the inability to get a good night's sleep, all of that, okay? So regardless of what form it is, real or perceived, imagined, in the brain, you know, or just too much, body has become toxic, it's going to fire this pathway. When this pathway fires, the first hormone on the scene, the real main first communicator, there's several times to get to this one, is cortisol. Now, cortisol is a really important hormone. It does a lot of good things in the right amount. Too much is really dangerous. And when that fires, the job of cortisol is to go over and talk to the liver and say, hey, give me some glucose. I need it right now, because glucose is the fuel for our cells and for our muscles. It's what's used to convert into energy for the body. So, of course, if we're going to fight or flight, we need the fuel to do it, right? So it's a pretty amazing response the body has. So now cortisol goes and it helps to dump glucose into the system so that we can use it. In order to make that glucose really available and to make sure that we don't have dangerous amounts of it, insulin comes on the scene. And insulin is another hormone. And the job of that is to help drive glucose into the cells to make it usable. Now, if we're truly taking action, okay, then this is a perfect scenario. We have the fuel that we need for the job, we do what we need to do, we protect ourselves, and everything is good. But what we're living in today is that we're not taking action. We're sitting at a computer, we're sitting in traffic, we're on the phones, we're constantly just in a, for the most part, a sedentary position. We're laying in our bed at night just going, oh my God, I can't believe we can't shut it off, right? So we're not taking action. That fuel, that glucose, those hormones that are releasing it, they're going to keep releasing the hormones as long as that perceived trigger is there. So as long as you're having those thoughts, as long as you're looking at those emails, as long as you're focused on those deadlines, as long as you're cursing the other driver next to you, it's going to fire and fire and fire and fire and keep dumping these hormones and this glucose into your system, because your body says, we got to save her, we got to save him. They're going to hurt themselves. They're in danger. Fight or flight. If that energy doesn't get used, it gets converted and stored into belly fat. Okay, it gets converted and it primarily goes into this visceral area. It protects those internal organs because, again, it's stress. In a time of stress, the body's whole idea is to protect you. So it's going to wrap everything around, close things down, and hold on tight. God forbid, okay? We're battening down the hatches. So now we've increased cortisol, we've increased glucose, and we've increased insulin. Right there, that's the perfect combination for diabetes. So if you're high stress, you've got a really good chance that you're on the road to diabetes if you don't get your health under control. And you may already be there, okay? Diabetes is not just food, it's partially food, okay? And that's a whole other video for another time. But a lot of it is this hormone imbalance. Now, cortisol and insulin are both fat-storing hormones. And as we store this belly fat, there's a danger with this also, because this type of fat becomes a brown fat, which is an endocrine disruptor, meaning it's clouding the signals. It's really blocking a lot of the receptor sites so that the other hormones can lock in and deliver their message. Every hormone in your body is a messenger. So when we got too many people running around, everybody's trying to deliver messages, and if we've got this one that's really out of balance and just blocking everybody's path, well, your body can't get the right messages in the right amount of time. It's a lot of chaos, a lot of noise, a lot of confusion that's going on in your body because of this hormone, cortisol. So as the belly fat hangs out and increases, that it creates that endocrine disruption, like I told you, and it really trends to increase our estrogen levels. Now, this is both men and women. In women, estrogen's good in a certain balance. Too much, it increases our likelihood of breast cancer. So hormones are really a beautiful system, but we got to keep them in check and balance. Like everything, health is a state of balance. So there's a few other things that happen with this particular hormone gang, and it's really devastating in chronic high amounts. So cortisol also is very catabolic, meaning it breaks down the tissue of our body. One of the first tissues that it breaks down is this very protective mucosal lining in your GI system called secretory SIGA. And what you need to know about that is basically it's breaking it down and creating a situation called leaky gut. Things are leaking literally out of the gut that are not supposed to. And there's two things that happen with this. First, it causes malabsorption and malnutrition because the enzymes that your body needs to break down food and actually get the nutrients to deliver them to the cells and fire the synapses and create energy and think a thought and pump your blood, it's not getting there. So, and it's also not breaking down and digesting properly. So we're having malnutrition, we're having gas, we're having bloating, and literally that GI turns into a septic tank. It's not a good thing, okay? That's one part of it. The other thing is food particles are leaking out. They're leaking out into your circulatory system. The immune system sees it and says, this is not normal, this is not supposed to be here. It tags it. And now what that does, just like allergy season, is perceived a threat, and it's going to protect you anytime that threat gets back into that bloodstream, and it's going to attack it. So it creates inflammation. High cortisol is a pro-inflammatory state. Inflammation, look it up, don't just take my word for it. Inflammation is linked to so many chronic diseases. Diabetes, cardiovascular disease is the big one, heart attacks and strokes. It literally is, it's like this in our body, okay? Not only do you feel swollen, not only does it literally cause a swelling, that inflammation, too many people think of it like joint pain. It's doing this in your entire body. It inhibits a certain component, one pathway in your immune system. It blocks receptor cells, okay, the inflammation does. It creates bad hormones that disrupt the balance of the good neurotransmitters in our brain, meaning that it's decreasing things like serotonin and dopamine, which increases our likelihood of becoming depressed and really fatigued and having severe brain fog. So inflammation is bad. Cortisol is bad. Hormone imbalance is bad. They're all tied together. And there's so much more that's going on. Let me just take one more minute and give you just one more understanding. Again, there's many things, so you can begin to hopefully understand how stress, too much of something in our life, is really devastating because it's causing all of this other imbalance and destruction in not just one system of our body, but many systems of our body, okay? The last big thing, if you're really concerned with hormonal imbalance, not only are your hormones already being disrupted because of the high cortisol and the high insulin and the high estrogen, all of which are fat storing. And when we are in a fat storing mode, we know that we inhibit some of the fat burning hormones like testosterone and growth hormones. So some of those really good hormones for us get diminished and suppressed and decreased. When this pathway is firing, this cortisol loop, okay, the same pathway initiates to come over here for cortisol or to then come over here and make sex hormones. So things like testosterone and estrogen and even some of your progesterones, they get inhibited, they get suppressed because the building blocks are all going over to this guy to keep cortisol going, going, going. And think about it, folks. If the fight or flight response is a primal life-saving response, which is great, saving your life is going to trump any day of the week reproducing. It's just how it goes. So it breaks all of that. It really depletes that. And it creates a whole host of other things. So, you know, even things like as progesterone is off, then that inhibits how it talks to another hormone, melatonin, which impacts our sleep. So it's all interconnected. Now, take a breath. There's hope, okay? I'm not trying to scare you today. I just want you to be more aware so that you can walk away from this time watching this to say, wow, there's a lot going on, more than I realized, and I need some help getting it all put back together because I hope that you'll begin to become aware of the mental, emotional. But when your body has become toxic, too many chemical or environmental stressors, too much emotional, just too many hormones. Those hormones, they don't just kind of dissipate. You get these elevated levels, you get so much imbalance. When we become toxic inside our body, when this breakdown begins, this dysfunction occurs, it doesn't just go away by reducing your calories and starting to work out. Now, starting to work out is really good with hormone balancing, but there's certain types of workouts, okay? There's some things that are really bad for you. So if you are in complete hormonal disruption, getting on the treadmill and going for a run 40, 50, 60 minutes a day is one of the worst things you could be doing. So there's a lot you need to know and that we need to know clinically so that we can prescribe you not only the right clinical pathway, but the right lifestyle parameters. How do you really need to be eating? How do you really need to be exercising? When do you really need to be sleeping? What level of mental emotional stress is happening? What type of environmental stress? How do we reduce and remove that for you based on your specific results, your specific history, your specific chief complaints? So we do that. That's what we do. We reduce and we remove, but it's not just about eliminating, okay? Because then we got to go in and heal. So we go in and we begin to restore and rebuild the health and the vitality of all those systems that have been impacted. And gang, you know, because this is such a 24/7 thing for us, and again, it doesn't ever fully go away, knowledge is power. And if we don't get an upper hand on it, it's just this slow, insidious process. So we've got to clean it out, go in and heal it up, and then it's about really giving you back to you so that you're understanding and succeeding with maintaining. Okay, so it's not a quick fix. It's not a one and done. It can take months to correct, but it doesn't take months to feel better. You will start to feel better. You'll start to shed weight. You'll start to have more energy, clearer mind within days for most of my patients. When we get the right information, when we get you on the right path, and we begin to rebalance you physically, mentally, emotionally, spiritually, well then, man, life opens up. Your health is yours. Your life is yours. You're not a slave. You're not a victim. You're not just a victim to circumstance. You're the one in control. You're the one in the driver's seat. You're the one with the knowledge. You're aware. Then you're the one with the ability to choose. Is this helping me? Is this hurting me? Is this giving me greater health or greater disease? And as you are aware, as you have the knowledge, as you learn, as you go through this program, it's a clinical program with me as your doctor, but not only are we going to clinically fix you up, but I'm your coach and I'm your mentor. So we support you the whole way through, from a land of dis-ease into a land of health, into a land of dysfunction, into a land of resource and greater functionality and greater living. So it's really about giving you back to you. Now, if on any level this sounds like something that you want to do, then I want to see you. But again, I only can accept 21 patients a month in my program. That's it. We are on a pretty tight schedule around here, but if you're that person, I want you here. We'll make the room, we'll make the time, we'll get you in if you are committed. Now, here's how you qualify to be able to take the next step and to call and to come on in for that appointment is you've got to be suffering. I mean, you've got to be struggling. You've got to have a metabolic dysfunction or the idea that you've got the metabolic dysfunction because you've tried and for all your right actions, you can't get that weight off. You continue to be fatigued and you think you're doing all the right things, but nothing seems to be working, okay? If that sounds like you, that's step one of how you qualify. Next is you've got to matter enough to you. This has to matter enough to you because, gang, it's not just take a pill. It's not just take a vitamin and go for a walk and that's it, okay? It is about taking your health back, taking your life back, and you are the one doing it. I'm responsible to you, not for you. I can't do it for you. I'm going to guide you, I'm going to support you, and I'm going to be there through all of it the whole way. But the program and the process is fun. We've designed it so it's not uncomfortable, it's not hard, it's not scary. It's comfortable, it's fun, it's life-giving, it's exciting. You know, it's informative, and you learn and you've experienced for yourself. So if you haven't already, don't just take my word for it. Watch some of our patient testimonials that are on our website. If you're that committed, if you're that person, you've got a metabolic dysfunction, you've struggled, you're ready for a solution, and your commitment level's got to be an 8, 9, or a 10. Like kind of on that scale of 1 to 10, 10's the most. If you're there, then it's time to come in. If you're not there yet, it's okay. We'll be here when you're ready, okay? So if that sounds like you, then it's time to take that next step. Something that I need to let you know because I feel it's important, and a lot of people have this question. is functional medicine does fall in the land of alternative health care, okay? So while it is completely clinical, and Google functional medicine, look at some of the great doctors. Dr. Oz talks about it all the time. Dr. Mark Hyman, one of the most well-known MDs out there, the leader of the functional medicine practice today, it's out there. So Google it. Don't just take my word for it. Go find the information. But it does fall under alternative, meaning most insurance companies, unless you've got a good health savings account, don't really cover most of the services in the program. But don't let that stop you. If you've struggled, if you want an answer, if you want to get your life back, then you've got to believe in you, and you've got to matter enough. And money, if you want it to happen, the way will be made. We've got great financing programs. We've got great alternatives. For my people that want to be here and that are ready to be here, money is not an option. We find a way. There's always a solution, and I've seen it time and time again every day. So don't let it be a stop. If you want success, you got to know it's time. You got to know you deserve it. You've got to matter enough, and everything in your life that matters to you, the people that depend on you, you're no good to them if you're not taking care of you. So if you've struggled and you're ready to get your life back, then you're right where you need to be. And the next step is just to pick up the phone or to come on into the office and request an appointment. 770-454-8300, that's the office number. Or come to one of my talks. I give health talks all the time, stress, hormones, and health, and all around the city. So whatever feels like the next best step, but if you're ready, then don't wait. Just get yourself in here, and I'm going to look forward to seeing you and helping you give you back to you. So for today, I hope you took a lot away from this. It's been a pleasure. And until I see you and get the opportunity to care for you, stay happy, okay? It's important. Stay healthy and live well. I'm Dr. Melissa. I'll see you soon.